No one warns you about this part. For some women, childbirth doesn't just change their life. It changes their body in ways that feel terrifying. If your vagina feels looser after having kids, you are not crazy, and you are not alone. Here's the truth your doctor probably never told you. There are some thoughts that women never say out loud. Thoughts that stay buried at the bottom of their minds. Thoughts they fear might make them feel broken, less attractive, or even not enough. After childbirth, some women look in the mirror. Some avoid their partners. Some cry alone at night. And some quietly whisper to themselves, "Why does my vagina feel looser now? What happened to me? Will I ever feel the same again?" This video is for every woman who has ever felt that fear. For every mother who wondered if her body changed forever. For every partner who didn't know how to help. And for everyone who has been misled, shamed, or embarrassed about one of the most natural changes in the human body. Today, we're telling the truth every woman deserves to hear. Because what happens after childbirth does not make you less of a woman. It does not ruin your femininity, and it certainly does not define your worth. Hi, I am Dr. Dixon. Welcome at InfoHub today. If it's your first time coming across our YouTube channel, hit that red subscribe button to stay tuned. The silent fear many women carry. Millions of women around the world experience the feeling of a looser vagina after childbirth, but almost nobody talks about it. Not with friends, not with family, not even with their doctors. Why? Because society teaches women to be quiet about vaginal changes, to hide discomfort, to label their concerns as too personal or too shameful. But the truth is, this is a medical topic, not a shameful one. This is a physical change, not a failure. And it affects emotional, physical, and sexual wellness. Let's begin where every story starts, with what actually happens inside the body. What really happens to the vagina during childbirth. Most people imagine childbirth affecting only the surface. But the vagina is a complex system of muscles, nerves, fascia, ligaments, and connective tissue. During childbirth, 1. The pelvic floor stretches up to 3 times its normal length. These muscles hold the bladder, uterus, and rectum in place. Labor forces them to stretch beyond what any gym workout could ever do. 2. The vaginal canal expands dramatically, enough to allow a baby's head, often 9 to 10 centimeters wide, to pass through. That's more stretching than the human body experiences anywhere else. 3. Micro tears and tissue stress occur. Even if there's no major tearing, microscopic tears form inside the vaginal walls and surrounding muscles. 4. Nerves become temporarily overstretched. This can reduce sensation after delivery. 5. Hormones change drastically. Relaxin and estrogen fluctuations change muscle tightness and tissue elasticity. None of these changes mean your body is damaged. They mean your body brought life into the world. But these changes do explain why some women feel looser afterward. Let's go deeper. The truth about looseness. It's not what you think. Most women who say they feel looser are actually experiencing something more complex. A. Pelvic floor weakness. Not the vagina itself, but the muscles around it become weaker and less toned. When those muscles lose strength, the vagina may feel wider because the support structure is softer. B. Tissue elasticity changes. Just like the skin on your stomach can stretch during pregnancy, vaginal tissues stretch too. Some bounce back fully, some don't. C. Nerve changes. Reduced sensation. Sometimes it's not looseness. It's reduced sensitivity, which makes things feel different. D. Hormonal drops after birth. Postpartum estrogen levels are low, making tissues softer, thinner, and less firm. E. Delivery method matters, but not how you think. Vaginal birth changes the pelvic floor more than C-section. But even C-section moms can experience looseness due to pregnancy weight, pressure, and hormones. This is why the feeling is extremely common. And yet, almost nobody talks about it. Does the vagina ever go back to normal? Here is the truth every woman should know. The vagina is extraordinarily resilient. It is designed to stretch and then gradually recover. But recovery varies from woman to woman due to genetics, muscle tone before pregnancy, type of childbirth, size and position of the baby, whether there was tearing, how many births occurred, hormone levels, age, overall health. For some women, recovery takes weeks. For others, months. And for some, it takes longer without targeted strengthening. But you are not broken, you are not loose forever, and you are not alone. The next section goes even deeper, into the emotional and relationship side nobody discusses. The emotional impact. The invisible wound. Gynecologists often say, physical recovery is easier than emotional recovery. Many women silently struggle with feeling less confident, feeling unattractive, avoiding intimacy, feeling disconnected from their partner, fear that their partner will notice a difference, shame about their postpartum body. And many partners don't know what to say, how to help, or what is normal. But the truth is, most partners do not feel the difference as much as women think. Most concerns are related to self-perception, not physical changes. Most issues can be improved with pelvic floor recovery. You deserve to understand your body without shame. You deserve to reclaim your confidence. You deserve to feel whole again. This is where the gynecologist truth gets even deeper, going deeper into the physical, emotional, and hidden science. The gynecologist's explanation, what loose really means. When women say their vagina feels loose, gynecologists immediately think of one thing: pelvic floor dysfunction. This is not a disease, not a defect, not something to be ashamed of. It is simply when the pelvic muscles lose strength, coordination, or tightness. Imagine the pelvic floor like a hammock, strong, lifted, firm. During childbirth, that hammock is stretched, pushed, and strained for hours, sometimes even for 10, 20, or 30 hours of labor. After this, the hammock doesn't instantly snap back. It needs time, recovery, and sometimes training. That's the exact reason many women say, I feel wider. I don't grip like I used to. I feel empty inside. I feel like things are falling. Sex feels different. These are muscular changes, not damage. Let's break it down deeper. The 3 layers of the pelvic floor, and how childbirth affects each one. Most people don't realize the pelvic floor has multiple layers, each playing a unique role. 1. The superficial layer, the outer muscles. These muscles help with sexual sensation and tightness. Childbirth can stretch them significantly. 2. The middle layer, the support muscles. These help control the urethra, vagina, and rectum. When weakened, women may experience reduced sensation during sex, difficulty controlling urine, a feeling of pressure or heaviness. 3. The deep layer, the foundation muscles. These are the main stabilizers. They provide strength, support the organs, and maintain core stability. A long labor or large baby can weaken these deeply. When all 3 layers relax or weaken, the vagina feels different, softer, or less tight, even though the vaginal canal itself is not broken. Most women describe the sensation as looseness, but the real cause is a combination of muscle stretching, nerve changes, and hormone shifts. Why some women feel looser than others? Every woman's recovery is different. Gynecologists point to 6 major reasons why looseness varies. 1. Genetics. Some women naturally have more elastic tissues, just like some people have stretchier skin. 2. Size of the baby. Larger babies require more stretching of the pelvic muscles. 3. Duration of labor. Long labors equal more stress on pelvic floor tissues, especially if pushing lasts more than 2 hours. 4. Tearing or episiotomy. Tears often heal well, but scar tissue can change how the muscles function. 5. Number of deliveries. Each additional childbirth increases the percentage of pelvic floor stretching. A woman who has had 1 baby may regain 85 to 95% of tone. 2 babies may regain 70 to 80%. 3+ babies may regain less without targeted exercises. And again, none of this means something is wrong. It's simply physiology. 6. Hormonal levels. After childbirth, especially during breastfeeding, estrogen levels drop sharply. Low estrogen equals softer tissues, less lubrication, thinner vaginal walls, reduced tightness. Once estrogen rises again after weaning or months postpartum, tissues naturally firm up. The most misunderstood part. It's not just about the vagina. Gynecologists emphasize, looseness is a whole body experience, not just a vaginal issue. Childbirth affects A. The core. Pregnancy separates abdominal muscles for up to 60% of women. A weak core reduces pelvic stability, leading to a softer pelvic floor. B. The back muscles. Back strain changes posture and alignment, altering pelvic pressure. C. The breathing system. Yes, even your breathing affects vaginal tightness. A woman with shallow breathing cannot effectively engage her pelvic floor. D. Mental state. Stress increases cortisol, which reduces estrogen and muscle tone. That's why emotional healing is just as important as physical healing. How looseness affects intimacy. The truth. Nobody says out loud. Many women feel embarrassed to talk about sex after childbirth. But this silence destroys relationships more than the physical changes themselves. Here's the raw, honest truth gynecologists want every woman to know. 1. Most men don't notice the difference. Studies show men are far less sensitive to small changes than women believe. Women perceive every tiny shift. Men perceive much less. 2. Sensation loss equals less pleasure. Many women confuse, "I don't feel as much," with, "I must be looser." Not true. Sometimes it's nerve overstretching that reduces sensation, not width. 3. Fear can make intimacy worse. If a woman is anxious, ashamed, or insecure, her pelvic floor tightens involuntarily, reducing pleasure. The mind and pelvic muscles are deeply connected. 4. Lubrication decreases postpartum. Low lubrication during breastfeeding makes sex feel less pleasurable, more friction-based, sometimes painful. This has nothing to do with looseness. 5. Communication can transform everything. Partners often assume silence means rejection. Women often assume partners will judge their bodies. Breaking that silence changes everything. The biological miracle. Your body is designed to heal. Here's the uplifting scientific truth. The vagina is one of the fastest healing organs in the entire human body. Vaginal tissues regenerate quickly. Nerves slowly recover sensation. Pelvic muscles rebuild strength with the right exercises. Hormones return to balance. Your body is not failing you. It is doing exactly what it was designed to do. What's happening to you is normal, expected, and totally reversible in most cases. But this brings us to the question every mother wants answered. Can looseness be fixed or improved? Yes, absolutely. And not just a little. For many women, improvement can be dramatic. But before we get to solutions, we must understand the real causes on a deeper level. The deep science behind postpartum looseness and the hidden causes most women never hear about. The hidden causes doctors don't always explain. Most women think looseness is caused only by vaginal stretching. But gynecologists emphasize that the truth is far more complex. There are 5 deep factors that influence postpartum vaginal changes, and most women know only one of them. Let's break them down. 1. Neuromuscular disconnection. This is one of the least understood causes. During childbirth, nerves connected to the pelvic floor become stretched. Not damaged, just overstretched. Imagine unplugging a cable halfway. The muscles still exist, but the brain has trouble activating them. So even if the muscles are strong, women may not feel tightness, control, grip, sensation. This can create the illusion of looseness even when tissues are normal. 2. Pelvic organ descent, mild prolapse. After childbirth, the pelvic organs may sit slightly lower due to stretching. Not serious prolapse, just subtle descent. This can cause heaviness, pressure, a dropping sensation, a feeling of emptiness, weaker sexual sensation. Many women think something is wrong or loose, but actually the organs are adjusting to their new support system. 3. Fascia damage. The fascia is the connective tissue that holds the vagina in shape internally. Childbirth can overstretch the fascia, causing less internal resistance, a feeling of softness inside, difficulty with muscle engagement. Fascia heals slowly, but it does heal, especially with specific exercises. 4. Hormonal laxity. Relaxin and progesterone stay active after childbirth. These hormones soften tissues, joints, and muscles. If you feel looser in the first months postpartum, this is a major reason. Once hormones settle, firmness increases again. 5. The brain-pelvic floor loop. Emotion, stress, trauma, fear, and exhaustion can weaken the pelvic floor. Why? Because the pelvic floor responds directly to anxiety, stress, sleep deprivation, Insecurity, fear of pain during sex. This is the mind-body connection that most doctors skip. Why some women never feel looser, even after giving birth. You may know women who say, "I had children, but I didn't feel any different down there." Why? These are the real reasons. 1. Genetics, strong elasticity plus strong muscles. Some women naturally have shorter pelvic floors, denser connective tissue, higher collagen levels, stronger muscle tone. Their bodies bounce back quickly. 2. Strong pelvic floor before pregnancy. Women who were active, did Pilates, or had good muscle tone before giving birth recover faster. The pelvic floor has muscle memory. 3. Shorter labors. Less time pushing, less stress on pelvic floor, faster recovery. 4. No tearing plus no instrumental delivery. Forceps, vacuum assistance, or severe tearing often increase postpartum softness. Women without these usually recover quicker. 5. Proper postpartum healing time. Some women rest, recover, and avoid early strain. Others jump back into the heavy lifting, standing, long walks, or chores too soon, slowing recovery. The reality many women face but never talk about. After childbirth, many women live in silence. They notice changes like tampons falling out, air entering the vagina, queefing, less tightness, weaker orgasms, dryness, difficulty gripping, a feeling of openness, changes in friction during sex, pelvic heaviness. Some cry alone. Some feel embarrassed. Some avoid intimacy because they don't feel like themselves. But here's the gynecologist truth. None of these changes mean a woman is damaged. None mean her sex life is over. None mean she's less desirable. None mean she's less feminine. These are normal physiological responses, and they are often reversible. Let's go deeper. What happens inside the vagina right after birth? Immediately postpartum, this is what the body experiences. 1. Vaginal canal swells. Swelling makes the vagina temporarily feel softer, warmer, less firm. Within weeks, swelling reduces. 2. Muscles lose immediate tone. Just like stretching a rubber band past its limit, the muscles need time to recoil. This takes weeks to months. 3. Micro tears begin healing. These tiny tears heal quickly, usually within 1 to 2 weeks. 4. Hormones drop. Especially in breastfeeding mothers, estrogen becomes very low. This causes dryness, thin tissue, reduced lubrication, decreased sexual sensation. This is not looseness, it's hormonal. 5. Nerves go into shock. Nerve endings take time to regain full communication with the brain. Sensations usually return gradually. The 6-month mark. What doctors expect. Gynecologists tell women, give your body 6 full months before judging anything. By 6 months, muscles begin regaining tone, nerves reconnect, hormones settle, estrogen slowly rises, fascia strengthens, pelvic organs lift slightly, sensation improves, lubrication increases. Some women feel normal by 6 months, others take a year. Some need targeted exercises, but improvement is the rule, not the exception. The 1-year mark. When some women see their biggest changes. Yes, many women see their biggest recovery between 6 to 12 months postpartum. Why? Hormones normalize. Pelvic floor therapy begins working. Internal tissues repair fully. Emotional stress decreases. Sleep improves. Breastfeeding ends or reduces. This period is when many women regain tightness, control, stronger orgasms, better lubrication, more sensation, confidence. So if you're only a few weeks or months postpartum, your recovery has barely begun. The emotional recovery. Few talk about. Women are often told, your body bounced back? Good. Your stomach is flat? Great. Your stitches healed? Perfect. But nobody asks, how do you feel? Because emotional healing is just as important as physical recovery. Childbirth changes the way many women see their bodies, feel about intimacy, interpret their attractiveness, connect with their partners, view their femininity. Confidence often drops, fear increases, shame grows silently. But once women understand that their experience is normal And that recovery is not only possible but expected. Confidence returns. The truth is, you are not alone. You are not broken. You are not loose. You are healing. You are strong. You are extraordinary. And we're only getting deeper from here. The science of recovery, what helps, what hurts, and the truth about postpartum healing, what actually helps tightness return. According to gynecologists, most women don't realize this, but the vagina is one of the most recoverable parts of the female body. What matters is understanding what helps the healing process and what quietly slows it down. Here are the top medical recommendations. 1. Pelvic floor exercises, Kegels, but done correctly. Most women think they know how to do Kegels, but most do them incorrectly, which actually weakens the pelvic floor over time. A correct Kegel involves lifting, squeezing, and holding the pelvic muscles, not tightening the stomach, not squeezing the thighs, not holding your breath. Gynecologists recommend 3 sets daily, 10 to 15 repetitions. Hold each contraction for 5 seconds. Done consistently, Kegels can reverse up to 70% of looseness caused by muscle weakness. 2. Deep core strengthening. The pelvic floor and core are best friends. You cannot strengthen one without affecting the other. Exercises that help. Pilates, deep core breathing, transverse abdominis exercises, postpartum yoga, gentle ab workouts. A strong core pulls the pelvic floor upward, restoring lift and tightness. 3. Squats, especially deep squats. Deep squats engage pelvic muscles, glutes, lower core, fascia support, internal muscles. This builds back the foundation that childbirth stretches. Gynecologists recommend 15 to 20 deep squats daily for noticeable results. 4. Avoiding heavy lifting early on. Lifting too early puts pressure downward onto the pelvic floor, stretching it further. This slows healing dramatically. Doctors recommend no heavy lifting for 3 to 6 months, gradually increasing load, keeping good posture during lifting. The pelvic floor must heal before being overloaded. 5. Estrogen support, natural or medical. Low estrogen equals thin, soft tissue. Normal estrogen equals firmer, stronger tissue. For breastfeeding moms, estrogen is naturally low. This can reduce lubrication, thin the walls, decrease elasticity, weaken tone. Once breastfeeding ends, estrogen rises again, and the vagina becomes naturally tighter. 6. Libido recovery. Believe it or not, libido affects tightness. Good sexual arousal increases blood flow, muscle activation, lubrication, nerve stimulation. This strengthens the entire pelvic system. 7. Professional pelvic floor therapy. This is the fastest, most effective way to restore tightness. Therapists use internal muscle mapping, biofeedback sensors, muscle retraining, targeted strengthening, relaxation techniques, scar tissue massage, nerve reconnection strategies. Women often see dramatic changes within 6 to 12 weeks. What makes looseness worse? The hidden mistakes most new moms don't know they're making. Even innocent actions can weaken the pelvic floor without women realizing it. Here are the top culprits. 1. Holding your breath when lifting things. This increases abdominal pressure and pushes the pelvic floor downward. 2. Constipation and straining on the toilet. Straining is like doing the worst exercise for your pelvic floor. Hydration and fiber matter more than most women realize. 3. Excessive long walks immediately after birth. Gentle walking is good, but long walks over 30 minutes too soon increase pelvic strain. 4. Jumping, running, high-impact exercise. These movements force the pelvic floor downward with every impact. Women should avoid jumping jacks, jogging, skipping, trampoline workouts, especially in the first 3 to 6 months postpartum. 5. Being overwhelmed or stressed. This one surprises most women. Stress tightens upper body muscles and weakens pelvic muscles over time. Cortisol reduces collagen and estrogen, leading to softer, weaker pelvic tissues. 6. Early sexual activity. If tissues haven't healed, early sex can increase soreness, reduce sensation, irritate tissues, delay healing. Doctors typically advise waiting 6 weeks minimum. and sometimes longer. 7. Not sleeping enough. The pelvic floor heals while the body sleeps. Little sleep equals slow healing. The biggest myth of all. The vagina is stretched permanently after birth. This myth has damaged women emotionally, mentally, and sexually for generations. Here's the medical truth. The vagina does not stay permanently stretched. It recovers drastically within months. Most women regain 80 to 95% of their original tightness. Why? Because the vagina is elastic, not like a balloon, but like a muscle. It stretches and contracts. It expands and recovers. It is designed for childbirth. Just as the uterus returns to normal size and the stomach muscles recover, the vagina undergoes its own healing journey. The only time looseness persists long-term is when healing is slow, muscles remain weak, recovery isn't supported, or severe tearing affects deeper layers. Even then, there are solutions covered soon. Why women feel embarrassed. The psychological effects nobody talks about. After childbirth, many women develop body insecurity, fear of rejection, fear of being judged by their partner, fear that sex won't be pleasurable anymore, comparison to pre-birth sensation, shame talking about their vagina. Some even think, I'm not tight enough anymore. I am not sexy anymore. What if my partner notices a difference? What if I disappoint them? These thoughts are painful. But here's what gynecologists emphasize. Your partner is not thinking what you're afraid of. Your body is not ruined. You are not less attractive. You are not less of a woman. These fears fade as understanding increases. And that's why this deep education matters so much. The 3 types of postpartum looseness, and how to identify yours. There are 3 medically recognized types of postpartum looseness. 1. Muscular looseness, most common. This comes purely from stretching of pelvic muscles. Symptoms include softer grip, less tightness during sex, weaker orgasms, a feeling of wideness. This type is highly reversible. 2. Sensory looseness, nerve-related. This type is mostly about reduced sensation, not actual width. Women may feel numbness, less pleasure, less response, lack of stimulation. Nerves take time, but they do recover. 3. Structural looseness, least common. This is when fascia or pelvic support systems are affected. Symptoms include heaviness, organs sitting lower, difficulty holding tampons, occasional leakage, a feeling of pressure. Even this type can be improved, but it often requires pelvic therapy. The role of orgasms in tightness. The truth. Nobody says. Yes, orgasms help restore tightness. Here's why. During orgasm, the pelvic floor contracts rhythmically. Blood flow increases. Lubrication improves. Muscles gain strength. Internal tissues tighten. Nerves reactivate. Regular orgasms, solo or partnered, help. Improve nerve sensitivity. Strengthen pelvic floor tone. Increase vaginal elasticity. Boost libido. Support emotional recovery. This is a natural, biological restoring mechanism. Why your vagina feels different. After multiple childbirths, women with 2, 3, or 4 children often notice slower recovery, more heaviness, more looseness, more pressure, slightly lower muscle tone. Why? Because each childbirth stretches muscles, fascia, ligaments, nerves. Recovery still happens, but it takes more time and more targeted exercises. This is completely normal. Your body is doing exactly what it is designed to do. Honestly speaking, if we continue diving deeper into this very main topic, the video is going to be more longer. So let's wrap it up from here. All right. Ladies, and anyone who cares about women's health, we've come to the end of this deep dive. If this video helped you understand your body better, or if it made you feel seen and reassured, then please do me one big favor. Give this video a thumbs up, and don't forget to subscribe to our YouTube channel at InfoHub today, so you never miss out on more honest, science-backed health tips, just like this one. You can also check out InfoHub Today's store from the verified store on the link beneath this video. Thank you so much for watching, and as always, take care of your body. See you in the next video.